I'm Nick Chabrel. I studied initially medicine at Flinders University in Adelaide and did most of my orthopaedic training here at the various public hospitals in Adelaide. And once I'd finished that, went and did a few courses around the place before setting up at the Wakefield Orthopaedic Clinic. So I'm a shoulder and upper limb surgeon, which means mostly shoulder work, dealing with predominantly pain and difficulty moving shoulders, and to a lesser extent elbows and some hand and wrist work. I found the upper limb quite fascinating in that there's a lot of movement and a lot of small things going on, whereas lower limbs I found that there's a lot of force and a lot of structure involved, but not as much delicate movement going on. I quite enjoy getting things moving again. I find that professionally very satisfying, and it's a different approach to a smaller problem than perhaps the lower limb surgeons might deal with. I think Wakefield Orthopaedic Clinic offers quite a range of orthopaedic experience across several areas of orthopaedics. So we've got people covering everything from hands to shoulders to hips and to feet. We've also got very good access to the Wakefield Sports and Exercise Medicine Clinic with allied health and sports physicians who are able to assist us in managing patients who may not need surgical care but might need an exercise program or other specialised treatment that doesn't involve the surgeons necessarily doing their work. So we can cover quite a broad range of problems and a broad range of treatments under the one roof. Wakefield Orthopaedic Clinic has been a wonderful place to come and join with some very experienced surgeons that helped me develop in my early years, and we've now got some younger surgeons coming through that I hope I can mentor as well. It's a relatively conservative orthopaedic clinic that tries to make sure evidence-based orthopaedics is used to guide our decisions, and we're not doing silly treatments or things that are not going to help people out in the longer run. I see some patients who come in with severe pain and dysfunction in their arms, and for some of them we're able to make so much difference to their quality of life and their ability to use their arm. The most severe ones are coming in 2 months after their surgery and saying thank you for what we've done, and it's very gratifying to help people out that way.